suffers from has got its own unique mode of onset, course, progression, termination, and so on. This is also true so far as the suffering from an illness, and if it is a neurological disorder, probably the onset is said to be very, very spontaneous. Spontaneous in the sense most of the occasions person will not be able to account for any particular reason, suddenly he will be developing the symptoms. Person likely to suffer from an illness for no apparent reason, likely to continue. The course of the illness, it may progress, may show exacerbation and remission, or it may have only the remission course. This is a different course that is possible in this particular case. The recovery is possible by an energetic treatment, and also it is true that the treatment may be even required until the termination of the life. This is also true in most of the occasions. The patient who are suffering from this particular illness, when treated energetically, it's also true that functional disability to some extent is the rule in these patients. To quote an example in this particular regard, the GB syndrome, considered to be an illness related to the autoimmune pathology, can happen in any age group, mostly in case of the adults, particularly the axonal variety, and in about 30% of the patient may require very serious intensive care treatment like that of the ventilation that also is required. Recovery may be slow and it may take an year or so for the complete recovery, but still incomplete recovery is the usual phenomena that is seen in GB syndrome. Residual disability needs rehabilitation. Category of the illness related to the same nervous system, that's the amyotrophic lateral sclerosis, or even the categories related to the motor neuron disease is concerned, considered to be a degenerative disorder related to the nervous system. Severe functional disability related to the even to the person is incapacitated for the personal care, that's also possible with this. And the response to the treatment, that's available treatment, that's almost absent or nil. And further, sooner or later the patient passes into a fatal stage. This is possible. Say for example, in a matter of an year or two, the person is likely to go into the moribund stage. This is the course of the illness so far as the motor neuron disease is concerned. There are many other diseases that can be listed. Maybe the cerebrovascular accidents, maybe the other degenerative manifestations involving the thought process, or the degenerative diseases related to that of the extrapyramidal system. In all these occasions, so far as the story of the patient, if we consider in these categories of the illness, person will suffer from one or the other functional disability related to the nervous system. As soon as the patient develops one or the other symptoms, he is likely to consult his physician. The physician identifies that this is an illness related to the nervous system and he is referred to a specialist. Once he is referred to this specialist, of course, the specialist has to make a very pinpoint diagnosis. He is likely to be investigated several times. As the reports are got and the file is built up, the disease also progresses. Also, the patient is being treated. It may be the surgical treatment, palliative treatment, conservative treatment, radical treatment, or any particular treatment which is being planned. The patient understands that the response for the treatment is partial. There is a limitation for this particular treatment what he is taking. Once he understands that he is not completely getting rid of the illness, the patient is likely to think of an alternative. And this is how a patient who was suffering from the neurological disorder probably think of Ayurvedic medicine in this particular stage. And in about 60 to 70% of the patients who are suffering from the neurological disorder, they come to the Ayurvedic physician with a definite diagnosis and a definite treatment that he is taking. And another 20 to 30% of the patients who are quite aware that neurological conditions can be better treated by an Ayurvedic medicine, they may directly approach an Ayurvedic physician. But in most of the occasions, it is not the case. In most of the occasions, they get the final diagnosis done and they know about the prognosis, go to the internet to see about the details of the illness, they understand that this is the limitation so far as the treatment is concerned, then they think of an alternative treatment. And if this is the case, if the patient is brought to an Ayurvedic hospital for the treatment, what he is likely to do, mostly the conventional treatment what he is getting is continued in most of the occasions. And very few occasions the conventional treatment that the patient is taking is discontinued. Rather, the patient is advised to continue the same medication to have an additional benefit from the additional Ayurvedic treatment that is being done. Treatment which is being planned in almost all these neurological conditions, Ayurvedic treatment is concerned, once again, it is not a short-term treatment, rather it's likely to be long-term treatment, likely to continue for years or for the lifetime in most of these occasions. And so far as this particular treatment that is carried out in case of the neurological conditions are concerned, the patient requires twice or thrice a hospitalization in a year. So far as the whole course of the treatment which is adopted these days is concerned, the patient requires hospitalization even. And each hospitalization is for a period of 20 to 30 days depending upon the treatment which is planned in these occasions. In between, the domiciliary treatment or the oral medication is continued. This is the integrated approach that is being practiced these days so far as the Ayurvedic treatment in cases of the chronic neurological conditions are concerned. To quote some of the examples of the treatment that is being given during these periods of treatment, one of the treatment is the massage treatment. It's not the treatment that's for the promotion of the health, rather it is as a curative, it is being practiced. It's about 2 square meters of the organ is being exploited. Lipophilic active principle, the whole this particular organ is soaked in this so that it allows absorption of the medicine through this particular area further. Each square inch of skin with the 4.5 meters of blood vessels is allowed to absorb, and to facilitate the absorption, the heat is also applied. The treatment is known as the Snigdha Suveda. This particular form of treatment is planned. And further, terminal organ of there is a objection for this particular treatment somewhere whenever we start the treatment in this particular manner. People say that if there is a power failure and if the power station is not working, what will you do with applying the oil to the fluorescent bulb? That doesn't work. But so far as the Ayurvedic principle is totally different. It understands that the nervous system, the root of the nervous system is elsewhere, but its one end organ is in the skin. The Ayurveda believes that if you can if you can manipulate the end organ, which is that is the the nerve endings that are present in the skin, if it can be manipulated, it can even stimulate the base that is in the brain. And therefore, since this particular nervous system has got its one end organ in the skin that can be manipulated to stimulate the whole of the nervous system, with this particular intention, this particular massage treatment is being carried out. It's not the simple, pleasurable sensation of massage which is being carried out in patients who are suffering from the neurological disorder. Rather, it's considered to be a very effective treatment. And throughout India, there are several institutions where this research work is carried out as part and parcel of the postgraduate training program, like that of the NIA Jaipur, the IPJ Tandar Jamnagar, and even the SDM Ayurveda College, Udupi and Hassan. In all these institutions, the research works being carried out. Most of these research work are randomized clinical trials. Randomized clinical trials where the pre-test post-test design being adopted, and it has been proved that this particular treatment is very effective. And most of these research works are restricted to the randomized clinical trials, that too the phase 3 clinical trials, where it is being proved. And another form of the treatment which is adopted, which in these patients, is the Basti. And the Basti treatment, it simply refers to the about a liter of liquid medicine is deposited in the colon for the therapeutic purpose. And this particular colon is lined by the mucous membrane that has got both the secretory and the excretory functions. And this particular secretory and excretory function of this mucous membrane of the colon is 30 days depending upon the requirement. And one of the example is the Rajayapana Basti, that's also said to be very effective. This is also a hospitalized treatment that's being carried out in patients suffering from the chronic neurological disorders. Massage is one side, the Basti is on another side, and the Rasayana treatment is also said to be very, of a very efficient in treating these cases. This particular Rasayana treatment differs from the regular oral medication in terms of dosage, course, medicine and the disease. And they arrest the progression of the disease, reverses the pathology, improves the functional ability. Best example is the Bhargav Prokta Rasayana, Shilajita Rasayana, Nagabala Rasayana, Lakshana Rasayana are the examples. Bhargav Prokta Rasayana is very effective in cases of the motor neuron diseases. Shilajita Rasayana is very effective in the neurological diseases related to that of the cerebrovascular accident. Nagabala is very effective once again in the motor neuron disease. Lakshana is effective in case of the autoimmune disorders, and its efficacy is also proved by the randomized clinical trials. That's followed by the oral medication, usually done during the course of the domiciliary treatment. And when these therapeutic procedures are adopted, then arrest of progression is seen in about 60 to 70% of the patients. Not that the complete cure, but the disease progression is arrested. And remission by about 20 to 30% is also accounted. And then the functional disability is also reduced, and the person who is incapacitated for the personal care is made to care himself. This is the efficiency of the treatment. And if this particular treatment, if it has to be adopted, then what is required is an OPD section has to be established in the hospital, and the Ayu dispensary has to be established, and a Panchakrama theatre and the medical and paramedical personnel, if they are included in the established hospital, at a cost of about 3 to 5 lakhs, one can have an additional Ayurvedic wing in the hospital. So, the conventional medicine is the leader in the management of infections, traumatic and surgical diseases. There is no second opinion regarding that. Ayurveda may support by managing chronic, lingering and lifestyle disorders. That's also equally true. And the integration is the obligation to strengthen the patient benefits. With these words, I would like to step aside and request the organizer to proceed further, and you're most welcome for the discussion. Thank you.